Governor Quinn wants the people of Illinois to know that we are mobilizing all of the resources at our disposal to make sure that our public health system is prepared to take immediate action in the event that a case of Ebola is suspected or confirmed in our state. We recognize the concerns surrounding Ebola, but we want the public to rest assured that we have a strong and highly effective public health system, and it is taking full precaution to prepare for any potential cases of Ebola. Protecting the public from outbreak of disease is a basic function of our public health system. And we are continually working with our partners so that we are prepared to handle any threats to the public. We have been in regular contact with officials at the Department of Health and Human Services and the Centers for Disease Control and Prevention. In addition, Governor Quinn has directed Dr. LaMar Hasbrouck, our director of the Illinois Department of Public Health, to assemble leaders in the areas of public health, public safety, infectious disease, and healthcare delivery to inform our efforts and ensure that all stakeholders are working together and have the information and resources they need. They will serve as an advisory task force for these efforts. The governor will provide additional information next week when he formally announces this task force, its members, and its mission. Dr. Hasbrouck will have more to say about this, but I want to take this opportunity to stress that Ebola is not easily transmitted. However, although we know it's not easily transmitted, we do recognize that there is a potential for a case in Illinois. And if a case occurs, we will take immediate steps to contain it and to prevent its spread. With that, I will turn the podium over to Dr. LaMar Hasbrouck to introduce our guests and to speak more about our efforts.
Thank you. Thank you, Deputy Governor. So, good afternoon. We're here again. We were here last week. Before I get started on my comments, I'm going to introduce this all-star panel behind me who's helping us with our efforts. So starting from here and going all the way across, Jonathan Munkin, he's the director of IEMA. Last week we had his assistant here. Dr. Craig Conover, senior medical advisor with the health department and an infectious disease physician as well. Dr. Peter Orris, he's with our Illinois State Board of Health. George Gorda, the Illinois State Fire Marshal's Office, representing EMS. Dr. Michael Wall, he's the director and medical director of the Illinois Poison Center, Metropolitan Chicago Healthcare Council. They also run the poison control hotline and also have helped us to mobilize very quickly our Ebola hotline. You'll hear a little bit more about that. Dr. Karen Joshi, senior medical advisor, Cook County Department of Public Health. Dr. Rachel Rubin, Medical Officer, Cook County Department of Public Health. We have Dr. David Schwartz Stroger, Cook County Health and Hospital Systems. Dr. Alec Tomic, Director of Infection Prevention and Control from Rush. Dr. Derek Robinson, Executive Director for Illinois Hospital Association's Institute for Innovations in Care and Quality. Tom Ellett, Illinois Nurses Association. Angie Charlotte, Director of Quality and Education for the Illinois Critical Access Hospital Network. We have Beth Fiore, who is the President of the Illinois Association of Public Health Administrators, and Trish Annan, who is the Vice President of MCHC as well. So these folks represent our all-star panel that are not only supporting us in this effort, but we look to for support going forward in an advisory capacity, and we'll talk a little bit more about that as well. So I want to thank again Deputy Governor Thomas, as well as Governor Pat Quinn, who I spoke with just before this briefing, for their support. Again, I can't emphasize enough how much we thank you for being a partner and helping us to amplify and disseminate this information on behalf of the public. The purpose of today's briefing is really just twofold. One is to give you updates in terms of the readiness activities led by the state in partnership with these key stakeholders and many others. And then also we want to emphasize what's new since the last press event, our first Ebola press event last week. Let me start by giving you the bottom line first. And the bottom line first is that the state remains Ebola-free at this point in time, and there are no suspect persons of interest currently being investigated or evaluated that would require us to do any Ebola testing at this point. But also I'll have to emphasize that the risk to the state still remains less than zero as long as the epidemic is spinning out of control in the epicenter, the three countries. It's not controlled, it's not contained, and also given the number of travelers from those 3 countries specifically through our O'Hare airports, and we estimate that that might be as many as 20-25 travelers per day from those countries, not at risk, but from those countries. Let me just talk a little bit about the overall approach to this epidemic. This is a global epidemic. Or not a global epidemic, but this is an epidemic that has global impacts, obviously. The control and containment really has to focus the efforts, the assets, the resources. They really have to focus at the epicenter in these 3 countries. So that's really where all of our focus should be, and you know about those assets that the President has mobilized, as well as CDC. So that's where we want to focus. In addition to that, there's port of exit screening. So now you talk about layers of protection from the epicenter that you want to control and contain that can help buffer us from any potential harm. So the port of exit screenings have been going on for some weeks now. That is screening travelers from these epicenter countries and making sure their temperature is taken. They're being asked appropriate questions about their possible risk exposure and about any symptoms. The next layer of protection or ring of protection is really the port of entry screening, and you know that we've started that right today here at O'Hare. We started at JFK over the weekend, and there's 5 airports that are going to be getting the port of entry screening. Another barrier of protection. We know that O'Hare is one of those 5 airports, and we suspect that up to 95% of any traveler from these 3 countries are going to enter the United States through these 5 airports. So we have that additional ring of protection. The next ring would be the cooperating hospitals that work in conjunction with the quarantine station, the CDC-run quarantine station that's doing the screenings. Again, folks coming from these 3 countries are pulled out of line, are given additional screening questions, looked at for any signs and symptoms of illness, and contact information, et cetera. So we have cooperating hospitals that have to cooperate with the quarantine station if someone needs additional care. But in addition, there's other cooperating hospitals, and we'll talk about the concept of centers of excellence for the treatment of Ebola as we go forward. And then that last ring of protection is really the community buffers that need to be put into place to make sure that the contact tracing is done, to make sure that any imported case is not transmitted, that we can break that transmission, find out all those contacts and make sure they're taken under care, they're in the quarantine or isolation, they're given treatment and supportive treatment as need might be. So that's the general approach, again, starting at the epicenter and then rings of protection from there. So what's new in terms of the state, in terms of what we've been doing? So in addition to providing the guidance through various communication routes that I explained last week to the healthcare and the public health system, everything from how to triage a patient right up to how to deal with the medical waste, the hazardous medical waste, we have done a few things. I mentioned the port of entry screening, which started today. You know about the 24/7 hotline that we've stood up in collaboration with the Poison Center, and that hotline number you have, we are about one of about a half a dozen states that have a hotline, including Texas and Nebraska, Ohio, Wisconsin, and some others, North Carolina. So we've stood up our hotline. We now have state, or on the verge of having state laboratory capacity. So there's only been about a dozen state laboratories that have been given the capacity, and when I say that, I mean the reagents and the test kits to actually do in-state laboratory testing for Ebola. We are now one of those. We're going through our validation stage, and starting next week, we'll be able to do tests. Very significant, because what it means is that if we have a suspect case here in the state, we can get the results within hours, and we'll have a preliminary result, positive or negative. Any result that we have will also be confirmed by the CDC laboratory as a final confirmatory test. So that's new. We have upped our game in terms of enhanced communications. I talked to you about the SIREN, or the State of Illinois Rapid Electronic Notification System. So we've done targeted messaging in terms of specific groups and targeted messages for specific groups, those key audience players that need to be mobilized. We're working with IEMA, and you may hear a little bit about this in terms of establishing a notification system to first responders. So there's about 80,000 first responders across the state, and we want to make sure they're getting the information as well. We've started weekly briefings with the local health departments. We certify about 100 local health departments, and all public health really starts locally. So the local health department is important because they have the powers of quarantine locally. So we want to make sure they get their refresher trainings and they know how to activate those powers if needed. We've also started to do some readiness surveys, which will allow us to assess the statewide readiness by sectors and identify gaps, so we can actually see what they're actually missing in terms of their readiness. We've broadened the discussion on this concept of designated centers of excellence for treating Ebola virus disease, and this is a kind of a network of care model. Those hospitals choosing to step up and really commit to investing concentrated expertise, including, for example, identifying and training a cadre of staff, and those staff getting enhanced trainings and develop protocols that may be above and beyond the CDC protocols, making sure they have adequate personal protective equipment and ways to get additional personal protective equipment if needed, concentrated consultation with state and city health officials as well as CDC, transportation protocols, et cetera. So those who are going to step up and say, we can do this, we have the capacity, we have the resources, and we want to be the go-to place for treating these patients should we have one. So those discussions are underway. It is a local decision by the hospital, but we do know that there's a number of hospitals that are considering it. Not going to go prime time right now, so just to preempt your questions, because they're doing what they need to do to get to that level before they want to designate and make that announcement. And we can talk a little bit about that in the Q&A. Excuse me. And then lastly, we have begun to establish, as the Deputy Governor mentioned, an Ebola advisory task force. Is going to be composed of key sector members, those people who are really needed to be coordinated in the statewide response, many of which are represented here with me today. That task force will have the function of facilitating communication and sharing information. This is all about information, timely information in the hands of the folks who need to have it in terms of helping us with our response. Coordinate public messaging so we're not giving different messages to different audiences. We're all on the same page there. Discussing this concept of centers for excellence, assessing sector readiness, and collaborating to address those gaps. So if there's gaps in personal protective equipment, gaps in training, this advisory task force will really help in directing us to address those gaps. So I'm going to briefly have Director Munkin come up and say a few words, and then we'll go right into your Q&A, and hopefully we can answer. If I can, I'm sure all these folks can help us answer your questions. So, Director Munkin. Thank you, sir.
Thanks, Dr. Hasbrouck. Appreciate it. And thank you, everyone, for being here today. As Dr. Hasbrouck mentioned, we've really taken a holistic approach to this in terms of leveraging all the capabilities and assets of state agencies and local departments to make sure that this is a truly collaborative effort. From the perspective of the Illinois Emergency Management Agency, we're here to do any contingency planning that's necessary to make sure that plans that we have that are available to deal with these types of circumstances and situations are ready, that we're exercising those, and that everybody's informed of their roles and responsibilities within that. So we've looked at several different scenarios to make sure that we are prepared for any eventuality, and it really comes down to that information exchange and dissemination that Dr. Hasbrouck spoke of. So we have the Statewide Terrorism and Intelligence Center has a dedicated public health intelligence analyst that's really looking holistically at global and national information to make sure that all that is being absorbed and then disseminated to public safety personnel. We're also here to coordinate that public safety response when the time becomes necessary. So we make sure that law enforcement, EMTs, fire services, everybody is up to speed on all the best practices that are out there that are being shared, everything from the personal protective equipment that was mentioned earlier to making sure that everybody knows what to do in the event that they're faced with a suspect case or anything along those lines. So we're here and standing ready to make sure that we're prepared for anything that could pop up, and we're working very closely with the Department of Public Health and all the agencies represented here to make sure that we are ready. Thank you.